Following the general election result, the health service continues to find itself in a position where it faces two major challenges. Firstly, a need for more resource. Health service funding has been constrained for almost a decade now, and the pressures continue to build. For example, we've heard in only the last couple of days that the number of people who are having to wait more than 18 weeks for a routine operation on the NHS is at the highest level since 2008. The second big challenge facing the health service is the need for political bravery and support, and indeed support from the wider population, for some changes, and quite challenging changes, that need to be made to how health services are organised and delivered. For example, a need to move more services from hospital to community settings, using technology in some different ways, and making it easier for people to access health and care exactly when they want it and where they want it. On the funding issue, I think one message from the election last week was that a lot of the public have actually had enough of austerity and would be potentially prepared to pay more for better public services. So I'd like to think there's some hope there for some greater investment in health and social care in coming months and years. But on the issue of political bravery to make much needed changes to how health services are organised, I'm much less confident, because I think that with a hung parliament, it's going to be nigh on impossible for politicians to make any decisions that are difficult and that might threaten the majorities in their own individual constituencies. So for health and social care overall, I think the election leaves the challenges unchanged and only offers a glimmer of hope where funding's concerned.